Hi, I'm going to talk to you about medial epicondylitis surgery. I searched YouTube and the internet for videos on this particular type of surgery, and I could not find anything anywhere, whether it's an actual surgery being done or whether it's someone that's in the recovery process. So I figured I'd make this to people that have had this type of surgery understands the process of the rehabilitation. So medial is the inside of the elbow. The outside is lateral. Medial is what I had surgery on. That's the inside. So I went in the hospital around 10 o'clock, 10:30. They weighed me. They put an IV on me. They constantly ask you your name and your birth date and what body part you were having operated on. And then, of course, they ask the general questions, any health issues, stuff like that. Then the surgeon comes down. He asks you your name, the birth date, and then he tells you to point to the body part that he's going to do surgery on. So I had to lift my arm, point to it. He actually put his initials there. So I talked to him for a little bit about the surgery. Then the anesthesiologist come in. And I explained to them in the past I had problems with anesthesia. So they gave me a little pill to take that would eliminate nausea. I was nauseated in the past. So I did that. Just a little sip of water too. They didn't want to even give me a lot of water. And so I went up around maybe 12 o'clock for the surgery. And next thing I know, I woke up, it was around 4:30 or so. And what they did in this surgery is they cut me right here, of course. You know, that pointy part, that inner pointy part of the elbow. What they do is they cut the tendon. They actually cut the tendon, of course, cut the skin, cut the tendon off of the elbow. Then he cuts the bad part of the tendon off. He shaves the bone down so that the tendon has something, a smooth, or not a smooth surface, but a good surface to grow back to. Then he drills a couple holes in the bone, sutures the tendon back onto the bone. And then what they did is they have this splint. I'm wearing a splint here under this ace bandage. Okay, that's so that my arm stays at a 90-degree angle. And then if you notice, my palm is facing downward because this particular muscle here that was repaired, it works the wrist. So they want to keep the pressure off of that muscle, so that the tendon can, grow back good. So they keep the palm facing downward. Okay, so the splint is actually on the top here, comes down, it loops around, and it actually then is at the back of my arm, so that it stays at a 90-degree angle. Then they put gauze underneath here, then they wrap it with the ace bandage. Now, when I first came home, I was a little bit swollen. My hand was a little bit swollen because it's really tight here. So I took the ace bandage off myself, just loosened it a little bit. I didn't compromise the splint or anything because there's gauze that's wrapped around it. So my hand and my arm stayed at the 90-degree angle. And then I just, put the gauze back on. I mean the ace bandage. And then it was fine. But, and then what I want to tell you is when I take a shower, because I don't want this to get wet, I'll put a garbage bag around my arm. Then I'll tape it up here. Then when I'm taking a shower, I'll keep my arm up in the air when the water's running, just to make sure no water's going to get in here. And then I'll sew myself down. Same thing, turn the water back on, keep my arm up in the air. I did get it wet once. I just took the part that was wet and I hit it with a hairdryer and it was fine. Well, what they do is okay, so in the recovery room, I woke up around 4:30 or so, went up to surgery around 12. And I could barely wake up from the anesthesia. I mean, I could barely keep my eyes open. That's how bad it was. They gave me like ginger ale to eat, or drink I should say, crackers to eat, and they kept on telling me I got to eat, I got to, drink, blah, blah, blah. I just couldn't do it. So basically they kicked me out of the recovery room, and I went home around 6:30. I don't even remember the ride home. I couldn't even keep my eyes open. When I come home, I just hit the sack. I got up around 11:30, had a little bit to eat. Still feeling really tired, a little nauseous. So I just went back to bed. And then the next morning, the hospital calls you, see how you're feeling. I told them, you know, tired, nauseous. They said that's normal. So the first 2 days, it was really sore at the elbow here. They give you an ice bag, but it really doesn't work because there's so much gauze and the ace bandage, and you got the splint underneath here, so it really didn't help. You know, I could feel a little bit of the coolness, but not much. So another thing I tell you is they want you to keep your arm propped in the air, like say if you're sitting in a couch, because I guess because of blood flow or whatever, that way it reduces swelling. So I'll put a couple pillows under. I do have a sling to wear, like if I go somewhere or if I'm doing something around the house. They did give me Percocet to take, but I just took a couple Tylenol. So the pain, it's been almost 2 weeks since I had the surgery, and the pain has subsided. It is a little sore. I've bumped it a couple times. One thing I tell you though, you cannot do any type of lifting with this hand or arm. Heaviest thing I've lifted is a toothbrush. So you just find a way to do things, you know, whether you're using your legs, you know, to hold something or whatever, you know. But you can't do any lifting, you know, like I said, toothbrush and that's it, a paper towel. So I hope that this info has been good. I'm going to have my stitches out in 2 days, and they're going to put the splint back on. I'm not sure for how long. I will know that. I'm going to actually make another video and explain how that was done. You know, they take the stitches out, I guess they clean my arm, then they put the splint back on with gauze and ace bandage, you know, just to keep the arm from moving, you know, so that tendon grows back good, you know, gets a good start to grow back. And then, like I said, I'm going to make another video and update you on the progress. So hopefully this has been some good information. I'll make another video after I get my stitches out, and hope to see you soon. Thanks for watching.